morning, friends. Greetings and welcome to The Bright Side, your nutritional program dedicated to the understanding of the vast world of nutrition and nutritional supplementation. I'm your host, Pharmacist Ben, nutritional pharmacist from Boulder, Colorado. I specialize in using nutritional supplements where other healthcare practitioners use toxic pharmaceutical drugs and deadly medical procedures. If you suspect that there are natural nutritional roads to your health and vitality and well-being and to addressing your health challenges, whatever they may be, but you don't know where to begin, you have come to the right place. As you listen to The Bright Side every day, you are more and more in control of your body. You are more and more knowledgeable, and you know you can overcome any health issue. That's why we're here every day on The Bright Side, helping clear up the sometimes confusing world of nutrition and nutritional supplementation. Over the last 29 years of practicing pharmacy, I've seen drug-free recoveries from diabetes and hypertension and obesity and skin diseases like psoriasis, eczema, acne, rosacea, digestive ailments, autoimmune issues of all kinds, recoveries that by the standards of modern medicine can only be called a miracle, but what is in the world of the body, what is in the world of biology, standard operating procedure. Because the human biological system is a healing system, it's a regenerating system, it is designed divinely to heal and renew itself on a moment-to-moment basis. And while some folks may call that a miracle, it really is just the way the body works. If you have questions about health or nutrition or prescription drugs, we want to hear from you. We welcome your phone calls on The Bright Side. 844-236-6010 is our number. Try to call in early so we can get to as many calls as possible. 844-236-6010. If you have questions about the longevity products, ingredients, formulation, skincare, something you may have heard about or read about or something somebody told you. If you have questions about nutritional supplements, we can help you. We can help you get off your meds and get on a good nutritional supplement program. If you so desire, 844-236-6010 is our number on The Bright Side. If you want to purchase any of the longevity products you hear advertised on the program, you can call the Bright Side Ben phone team at 866-735-2470, or you can check out my website, brightsideben.com, and order products right off the website. You can also go to my blogs, pharmacistben.com and criticalhealthnews.com, which we update regularly with news stories and blog posts. There's also information about the longevity products on the blogs, on the websites. You can also call the phone team at 866-735-2470 if you want to order products, or if you want to sign up and join the Brightside Ben team and help spread the word about the power and importance of a good nutritional supplement program. Okay, 844-236-6010 is our number on The Bright Side. We'll get your phone calls here in a little bit. We're talking skin health, using the skin as an example of the health of the entire body. A skin health issue is a body health issue, and that's the main point. Everything we talk about here on The Bright Side, it's the main point about skin, it's the main point about what we've been talking about here for the last couple of weeks, and it's really the key point of what I call the Bright Side philosophy. The fact that when we have a bone issue or a muscle issue or a heart problem or a nerve problem or we got insomnia or any other physical health issue, including skin issues, our problem is not with the specific organ. It's not with the specific structure. This underlies the failure of modern medicine. It wants to treat the individual organs and the individual components as if they were segregated or divorced from the rest of the body. The body is a whole system. Everything is connected to everything else. The way you deal with a body problem is by addressing the health of the entire body. And once we understand this, it's going to become clear why doctors, and especially why specialists, are so impotent and helpless when it comes to reversing or eliminating disease. We rip on the medical model here all the time. I'm guilty. Mea culpa. Guilty as charged. But nothing highlights the utter intellectual bankruptcy, the health stupidity of the modern medical model more than specialists. Yes, doctoring really has no place when it comes to taking care of health, with the exception of stitching us up if we get hit by a bus. Or if we have something gets cut off of our body, surgeons can reattach it, and that's a miracle. Modern medicine, in terms of its technological prowess, in terms of surgery, is really quite miraculous. But as far as day-to-day health goes, medicine is a failure. Doctoring is a failure. But nothing is as utter a failure as specialists, or as specialism, if you will. Specialists, like all doctors, are helpless when it comes to reversing or eliminating disease because health challenges are not special problems. They're not problems of special systems or of special organs or of special chemical processes. They're whole body problems. We said this so many times in the program. All disease is cell disease, and all disease involves the same basic breakdowns: nutritional deficiency, sugar, and the accumulation of sugar toxicity and toxicity in general, and oxygen deprivation. Last week we talked about the relationship between low levels of oxygen and the formation of pimples, zits. When was the last time you heard your dermatologist talk about ductal hypoxia? That is, low levels of oxygen in follicles and in pores. Yet we know, according to a paper published in the Journal of the American Academy of Dermatology, May of last year, low oxygen in pores and in follicles, ductal hypoxia, that's the fancy way of saying it, was referred to as the missing link in the medical understanding of acne. Yet we still see stupid commercials for antibiotics that can cause chronic diarrhea and sun reactions and hyperpigmentation, an antibiotic called Onextin for adult acne. We still see these crazy strategies of killing bacteria, or benzoyl peroxide and tetracycline and doxycycline for treating acne, which is a manifestation of the same stuff that goes wrong when you have arthritis: nutritional deficiency, low levels of oxygen, and blood sugar issues. The bottom line here, folks, is if you have a skin issue, you got a health issue. If you have a skin issue, you have a body issue. Psoriasis, think digestion, food allergies, fatty vitamins, EFAs, minerals. Use probiotics and digestive enzymes. Nothing here is about the skin specifically, right? I'm not saying rub this on your skin. I'm just saying take care of your digestive system. Guess what? Your psoriasis will improve, and your likelihood of getting some horrible degenerative disease like cancer will decrease as well. Acne, think zinc and vitamin A, lower blood sugar, stabilize your insulin. Do you know until the 1960s dermatologists called acne skin diabetes, and they used to use diabetic medication for their acne patients? Acne is a hyper condition. Acne is a hyper-proliferative condition. That means it's a hypergrowth state. Cells are dividing super rapidly. Acne bacteria, the bacteria that are supposedly cause acne, technically Propionibacterium acnes, P. acnes, that's a technical name for the bad guy in acne. P. acnes turns on the functioning of insulin. It makes insulin more active, and because insulin stimulates the growth of cells, that means hyperproliferation. Yes, the P. acnes may be the direct cause of the formation of blemishes, but they work. The P. acnes causes the acne, causes the blemishes by affecting blood sugar and by affecting insulin. That means stabilize your insulin, and your acne will improve. That means stay away from insulin-spiking foods. Doctors or dermatologists laugh about chocolate and acne. They go, ha, ha, ha. Chocolate doesn't cause acne. Ha, ha, ha. Food doesn't cause acne. Ha, ha, ha. That's just crazy alternative medicine. Well, if your dermatologist says that, he needs to start reading his trade journals, including the American Academy of Dermatology, the Journal of the American Academy of Dermatology, and the Journal of Clinical Dermatology, etc. He should do some research. If your doctor is telling you that it has nothing to do with what you eat, your zits and your blemishes. Acne bacteria affect insulin. Insulin affects growth. Acne is a growth condition, skin cells dividing rapidly, at least partially. By the way, zinc not only down-regulates this pathway, zinc not only stabilizes insulin, but zinc also is involved in sugar metabolism. And zinc also has immune-boosting properties. And zinc also has antimicrobial properties. If you are taking your kid to a dermatologist for his zits, for his acne, or if you're an adult with acne, and you think you need a dermatologist, think again. You need zinc, not a doctor. 50 milligrams a day, zinc picolinate. Reduce your intake of insulin and sugar-spiking foods. Lay off the fruit juice and the desserts and the breads and the pastas, etc. Get on 50 milligrams of zinc picolinate. That's the best form of zinc. And get on your vitamin A, 20,000 IU a day. Throw in some selenium. Throw in some NAC. Use topical retinol in high concentrations. TruthTreatments.com. That's my retinol 5%. Not just for anti-aging, not just for dark spots, but also for blemishes. TruthTreatments.com. All right, I'm Pharmacist Ben. We're going to talk about dry skin when we come back from our break. You're listening to The Bright Side on the Genesis Communication Network. We'll be back right after this. Okay, we are back on The Bright Side. I'm Pharmacist Ben. Got some lines open for you at 8 844-236-6010, 844-236-6010. We'll get your calls here in our next segment. We're talking acne. If you have acne, if you have blemishes, if your kid has acne, number one, start supplementing. That means zinc, vitamin A. You could use something called NAC, N-acetylcysteine. Vitamin E can be helpful. Selenium can be helpful. Essential fatty acids can be helpful. A lot of times kids who have acne or adults who have acne think that essential fatty acids may make their skin more oily. Well, as it turns out, under conditions of essential fatty acid deficiency, your skin oils will become thicker and they'll tend to clog pores more readily. So using essential fatty acids, your ultimate EFAs, omega-6s and omega-3s, can have very important benefits for your acne patient or for yourself if you're dealing with acne. Topically, use retinol, high concentrations, dab it on the blemishes. I like retinol at 5% concentration. That's why I made my truthtreatments.com retinol gel. You can dab it on blemishes. You can use it for dark spots. You can use it as an anti-aging product or to get yourself a little mini peel without having to go to the spa. You can find out all about the retinol, my retinol gel, truthtreatments.com. Okay, 844-236-6010 is our number. We'll get your calls here in a minute. I want to talk a little bit about dry skin. Acne is an oily skin condition. And then dry skin is a lack of skin oils, a lack of skin lipids. If you have dry skin, please understand you don't need a new or a stronger or more expensive, quote, moisturizer, unquote. I always say moisturizer in quotes because there's really no such thing as a moisturizer. It's a marketing term. Moisture means water. So a moisturizer would be a shower or washing your face. Of course, that ends up drying your skin. So really, there's no such thing as a moisturizer except for as a marketing term. And by the way, dry skin is not about ambient humidity. It's not because you live in Colorado or you live in Arizona or Nevada or California. It's not because the air is dry that you have dry skin. Dry skin is a lack of water trapping properties or a lack of water trapping chemistry in the skin. It's a water trapping problem. That's why you can drink all the water you want and it's not going to help your dry skin. I still hear skincare professionals and doctors and such saying, oh, you got dry skin, drink more water. No, wrong, bad answer. You can drink all the water you want and it's not going to help your dry skin. Has anybody ever had their dry skin disappear because they drank more water? No, never, because it's not a water problem. It's a water trapping problem. Under ordinary conditions, there are water trapping chemicals, water trapping molecules, water binding molecules in the skin. So if you have dry skin, you want to work on water trapping, water binding, not water. Almost everyone who has dry skin thinks it has something to do with lack of moisture in the air. It does not have to do with lack of moisture in the air, although low ambient humidity, low moisture in the air can exacerbate the problem, but it's not going to cause the problem. The skin is an adaptive structure, like the whole body is an adaptive system. It adapts. The skin is particularly adaptive. It turns over really quickly. Do you know that when you come to Colorado or Arizona or Nevada or the desert from Miami, say, or New York, somewhere where there's lots of moisture in the air to somewhere where there's not, under ordinary conditions, if we're healthy, our skin will make more water-trapping molecules. How cool is that? The skin will adapt to low ambient humidity, to low moisture in the air by making more water-trapping molecules. This is so cool. That means that if you have dry skin, all you got to do is figure out how to make more water-trapping molecules, water-binding molecules. Oh, guess what? Moisturizers, they suppress water-trapping molecule chemistry. Oh, yeah, moisturizers, the super high-tech ones that Jennifer Aniston recommends that we use, they suppress your natural moisture factor molecules. That's what they're called, the natural moisture factor. Somebody should tell Jennifer Aniston that her moisturizing cream is going to make her dry skin worse. How ironic is that? Our moisturizers make our dry skin worse. I used to work for Blistex. That's where I learned my skincare chops, if you will. That's where I learned how to formulate, is working for the Blistex Corporation, and we love that at Blistex. That's why you get addicted to your Blistex, because when you put it on, your lips stop making water-trapping molecules, and then your Blistex or your chapstick or whatever it is, Carmex, wears off. And now your lips are super dry, and of course you use more product, which makes them even drier, and then use more product, which makes them even drier. That's called getting addicted to your lip medicine or your skin medicine.